A 72-year-old man named Robert is standing in his garden. It is a Tuesday morning, the sun is out, and he is just watering his hydrangeas. Suddenly, a crushing pressure grips his chest. It is not a sharp pain, like a knife. It is a weight, heavy, as if someone just placed a bag of wet cement right on his ribcage. Instantly, a cold, sticky sweat breaks out on his forehead. His left arm starts to tingle. He knows. He is having a massive heart attack. But here is the part that the ER doctors whispered about later in the corridors. Before he even dialed 911, Robert did something very specific. He did not lie down flat on the grass. He did not run inside. He did not drink sugar water. He used a shockingly simple technique, something so counterintuitive that cardiologists later said it likely preserved his heart muscle until the ambulance arrived. In the next few minutes, I am going to show you exactly what he did, because that small action was the difference between a heart with permanent scars and a full recovery. Because look, here is a reality that should make your stomach turn. Every 40 seconds, a heart stops in the United States. By the time I finish this sentence, it happened again. But what rarely gets discussed on the news or in the doctor's office is this. The first 10 minutes, before the sirens, before the hospital lights, before the angioplasty, it is in those 10 minutes, alone in your living room or bathroom, that your fate is often sealed. That window determines who goes home for Sunday dinner and who becomes a statistic. We call this the platinum window. Today, I am going to break the silence on two things every adult over 60 needs to understand. Not nice to know, needs to know. First, the phantom signs. Those silent warnings your body sends hours or days before a total collapse, which almost everyone ignores. And second, the method. The exact body position and kitchen chemistry you can use to keep your pump working while help is on the way. This is not folklore. This is not internet advice. This comes from modern emergency cardiology. But for Robert's technique to make sense to you, so you do not freeze when panic sets in, you need to understand what is actually happening inside your chest, because most people imagine a heart attack like in the movies. The actor grabs his chest, screams, and drops dead. Lights out. Real life? It is much more treacherous. A heart attack often starts quietly, subtly, almost politely, and that politeness is exactly why it kills. Think of your heart not as a Valentine, but as a machine. A high-performance V8 engine that has never, ever been turned off since the day you were born. To run, this engine needs constant fuel, oxygen-rich blood. That fuel is delivered by vital pipes called the coronary arteries. Now picture an old garden hose. Over decades, burgers, stress, genetics, a kind of rust builds up on the inside walls. Plaque, calcium, cholesterol. The water flow gets tighter, but the water still passes. The garden survives. You go on with your life. A heart attack does not happen just because the pipe gets clogged slowly. The real disaster is violent. It happens when one of those plaques ruptures. Imagine a small wound opening up inside your artery. The body, trying to help, rushes to heal that wound. It sends an army of cells to clot the blood right there. And this is the tragedy. The clot that was supposed to heal ends up blocking the passage 100%. Suddenly, silence. A part of that engine goes dark. No fuel. Sometimes the blockage is temporary. The engine sputters. You feel a pain that comes and goes. Doctors call this unstable angina. I call it the last warning. It is your heart pulling the fire alarm, screaming that the big one is minutes away. And here lies the real danger, the mental trap. Most seniors ignore these signals. Pain in the jaw. Oh, must be a toothache. Burning in the stomach. It was the spicy sauce at dinner. Sudden exhaustion climbing 3 steps. I am just getting old. People take an antacid, sit on the couch, and wait for it to pass. They assume it is nothing. But these are not random glitches. They are distress signals. When oxygen is cut off, heart cells begin to die in minutes. In medicine, we have a brutal saying, time is muscle, and dead muscle becomes scar tissue. It never beats again. There is a narrow window, tiny, before the blockage becomes total and permanent, where the body can still compensate. That window is where Robert's technique comes in. But first, what are the phantom signs? What should you look for? Because it does not always hurt the chest. Number 1, pressure, not pain. It is a squeeze, like an elephant sitting on you. Number 2, the traveling pain. Left arm, yes, but also the neck, the back, and especially the jaw. Number 3, the sense of doom. This is real. Patients report a sudden, cold anxiety, an absolute certainty that something terrible is about to happen. That is not psychological fear. That is biological. It is your primitive brain detecting a lack of oxygen before your conscious mind does. And the worst part? These symptoms flicker. They hurt for 5 minutes and stop. And when they stop, you relax. You think, phew, it passed. It did not pass. The bomb's timer just started ticking faster. Many of us, especially the older generation, were raised to be stoic. Don't make a scene. Don't bother the neighbors. You push through the discomfort. You bite your lip. That silence, that pride, can be deadly. Because the difference between acting now and waiting just a little longer is the difference between meeting your grandchildren or becoming a memory. So, enough theory. Let us get to the practical part. What did Robert do? What saved his life in that garden? It is called the myocardial self-preservation protocol. It sounds complex, but the logic is simple. Reduce the engine's load and thin the fuel. The moment symptoms strike, your heart is struggling to pump against a wall. Your number 1 priority is to make its job easier. Here is the step-by-step. Visualize this. Memorize this. Step 1, the position. The instinct for everyone is, I feel sick, I am going to lie down on the bed. Do, not do, that. It seems counterintuitive, I know. But listen, when you lie flat, completely horizontal, gravity rushes the blood from your legs back into your chest. You flood the heart. You are drowning an engine that is already failing. If the heart is weak, that fluid backs up into the lungs, and you essentially drown on dry land. So what do? Get on the floor, sit down, lean your back against a wall, a sofa, a tree, bend your knees, feet flat on the floor. You form a W shape with your body. Why does this work? This position traps some blood in the legs. It takes the heavy load off the heart, and it relaxes the diaphragm so you can breathe. You are using gravity as medicine. Step 2, the chemistry. Robert knew this. He had a bottle of aspirin nearby. He took a full-strength adult tablet, 325 milligrams, or you can take 4 baby aspirins. But he did not grab a glass of water. He did not swallow it. He chewed it. He crunched it in his teeth, made a paste with his saliva. Why is this vital? Why chew a bitter pill? Because if you swallow it whole, it goes to the stomach. It has to dissolve, pass through the liver. It takes 20-30 minutes to work. You do not have 30 minutes. By chewing and letting it dissolve in your mouth, the medication enters through the blood vessels under your tongue. In 5 minutes, it is in your blood. Aspirin attacks the platelets. It makes the blood slippery. It stops that clot from growing and sealing the artery completely. It is the single fastest intervention that exists outside of an ICU. Step 3, the control. Panic. Panic is the enemy. Panic releases adrenaline. Adrenaline is rocket fuel. It makes the heart race. A heart having a heart attack cannot race. Robert closed his eyes. Inhale short through the nose. Exhale very slowly through the mouth, as if you are trying to inflate a giant soap bubble without popping it. This tells the brain, don't run, save energy. Sit in the W, chew the aspirin, breathe, and of course, scream for help. Call 911. But while they are not there, you are fighting. You might be thinking, if it is that simple, why doesn't everyone talk about it? They do. It is in the medical textbooks. Guidelines from the American Heart Association. Class 1 recommendation, irrefutable evidence. Studies show that early aspirin administration reduces mortality by 23%. 23%. Just by chewing a penny's worth pill. This is not a magic cure. The blockage is still there. This does not replace the hospital. This buys time. And in cardiovascular medicine, time is everything. The difference between arriving at the hospital with the muscle merely stunned or with the tissue dead. Imagine this moment for yourself. God forbid, but imagine it. You are scared. The chest hurts. But instead of blind desperation, you have a plan. You know what to do. Having a plan restores control. Panic consumes oxygen. Calm preserves it. Knowing how to act preserves heart tissue until the professionals take over. Now I want to shift the tone. I want to talk about hope. Many think that after a heart scare, life is over. You become a glass vase waiting to shatter. That is a lie. The human body is miraculous. There is a phenomenon called collateral circulation. Your heart is not static. It learns. When a main highway, an artery, starts to get bad, the heart has the intelligence to build shortcuts. Tiny new blood vessels grow around the blockage, a natural bypass, but it needs stimulus to do this. Gentle walking, movement, seniors who move, who garden, who walk the block, stimulate this construction of new roads. And nutrition? There is a magic molecule. It is called nitric oxide. It relaxes the arteries, makes them wide, flexible. Where is it? Beets, spinach, garlic, dark chocolate. Eating this is not a diet. It is internal engineering. You are building a fortress around your heart. And the last tip for prevention. Perhaps the most important one. The morning danger zone. Statistically, most heart attacks happen between 6 a.m. and 9 a.m. Why? Because when you wake up, your body dumps cortisol into your blood to wake you up. Blood pressure spikes, and your blood is thick because you have not had water all night. I teach the activation ritual. Number 1, water first. Before the black coffee, a big glass of water. Dilute your blood. Take it out of ketchup mode and make it fluid. Number 2, don't jump up. Woke up? Sit on the edge of the bed. Wait a minute. Let the pressure adjust. Do not demand 0 to 60 from your heart in seconds. Number 3, light. Open the curtains. Light regulates stress, small things. But add it up. They save lives. Let us go back to Robert. When the ambulance turned onto his street, he was there. Sitting on the ground, leaning against the garden wall. Pale, yes. In pain, yes. But conscious. Chewing his aspirin. Breathing. The paramedic noticed that despite the massive attack, his vitals were strangely stable. Weeks later, the doctor was clear with the family. His reaction saved the bottom wall of his heart. This is the power of preparation. Knowledge transforms fear into purpose. And that is what I want to leave you with today. I do not want you to live in fear of a heart attack. I want you to live with readiness. Readiness gives you power. It gives peace of mind to your children, to your grandchildren. Aging is not decline. It is accumulating wisdom. So, lock this line in your head, like a mantra. Chest pain? Don't lie flat. Sit in the W. Chew the aspirin. Breathe. Simple. Clear. Life-saving. Health is not about avoiding every crisis life throws at you. It is about knowing exactly what to do when the storm hits. If you listened this far, do me a favor and do yourself one. Share this. Send it to the family group chat. Show your father. Tell your neighbor. Because the next life this knowledge protects might be someone you love very much. Practice mentally now. Sit. Chew. Breathe. Be ready. Your heart fights for you every single beat. Learn to fight for it too. But listen closely now. You just learned how to save the engine of your life. But there is an even more silent threat that attacks your central computer. Your brain. A heart attack warns you with pain and pressure. A stroke often warns you with failure. Would you know if that moment when your wife's face looked slightly droopy on one side or her speech sounded slurred was just fatigue, or a brain shutdown happening that very second. Many times there is no pain. The person just fades away. There is a specific smile test that doctors use to identify a stroke in seconds. The technique to save your brain and avoid permanent paralysis is in this video right here on the screen. Don't leave it to luck. If the heart pumps life, the brain is who you are. Click now and learn the test. I will see you there.